Welcome back to InjuryGuru.com. I'm Carla Schimmelfinnig, registered physical therapist, and this is the second exercise program for the knee replacement exercise program. First video in this program, and most likely you are probably anywhere from a few weeks after surgery, if you're watching this video, a few weeks after surgery to even up to 2 or 3 months after surgery, just depending again on where you're at in that process and when you started the whole exercise routine and program. So this is exercise program number 2 for that knee replacement, and I just want to say congratulations, you made it through my first exercise program, and now you're on to the second one. So I know you're committed to getting your strength and endurance back and getting that walk back, so that no one knows that you've even had a knee replacement. So just congratulations, and I'm really happy for you. Good job sticking with it. And in this video, I just want to share a couple more things with you, some reminders, as well as the first exercise in this exercise program that you'll actually be pretty familiar with. So the first thing I just want to mention in this video is just remember to continue checking in with your doctor. Make sure you're going for those regular scheduled appointments, or you give your doctor a call if anything doesn't seem to be going quite right. If you think it's not going quite right, it probably isn't. So it's just best to let your doctor take a look at you. And also it just gives you a really good peace of mind for your doctor to take a look at things and just give you the okay that you're doing fine and just keep progressing. Another thing I just want to remind you is just don't overdo it. So you need to be taking it easy, and your body will tell you if you need to take it easy or not. So your body's going to tell you if you're overdoing things by just feeling tired, having more swelling and more pain in that knee. So just listen and make sure you're taking it easy. Another thing that you might want to keep doing, just depending on where you're at in this process, is that ice and elevation. It still can be really helpful. If you're having swelling, warmth in that knee, it just still gets up some pain, you get a little pain in that knee, or even more than a little pain, then ice and elevation is still really helpful at this point, so don't forget about those. And lastly, I just want to remind you to keep walking, whether it's in a gym or at a local store, one of those big giant grocery stores where you can get 2 things done at once. You can get your walking in and your grocery shopping. Or if it's nice out where you live and you can get outside and walk, then just keep walking and then exercising. So just watch all the videos in this exercise program and get started going, and let's just see if we can't get you back to, like I said, walking normally so that no one knows you've even had a knee replacement. Get all that strength and balance and endurance back so that you can get back to doing all those things that you need to do, and a lot of those things that you haven't been able to do for a while. The first exercise in this exercise program is one that you are very familiar with. It's a straight leg raise. And I call this one a straight leg raise with a quad set because you're going to combine those 2 exercises together. So let me just show you what that one looks like. For this exercise, you're going to be in this position laying down. You can lay back on your elbows, so rest on your elbows like I am, or you can lay all the way flat. It's really up to you, whatever is more comfortable. Make sure, though, in either position that you have your good knee bent up like this, just so it just saves the back. It's a little easier on the back. So remember, if you'll remember from the first exercise program, for this exercise, like I said, it's a straight leg raise with a quad set. So what you want to do is make sure you tighten up that quad, and remember to tighten up the muscle on top of the thigh. You want to push the back of the knee down toward the couch or the bed or the floor, wherever you're exercising. So you're going to tighten that up, lift, lower, and relax. And that's all it is, that straight leg raise with a real strong quad set. So you're going to tighten that up first, lift the leg, lower, nice and controlled, and relax. Tighten, lift, and you want to lift to about the height of your other knee, lower, nice and controlled, and relax. Tighten, lift, lower, and relax. Alright, so for that exercise, you're going to do 3 sets of 10 to 15 repetitions. You just wanted to get nice and tired. At this stage, since you've already been exercising, your strength is coming back, your endurance is coming back. If you have some cuff weights and light cuff weights, so anywhere from a 1 to a 5-pound cuff weight, go ahead and throw that on your ankle. It just makes it a little bit harder, makes that leg work even more, which is just going to give you some more strength. once to twice a day for these exercises, at least once a day, but if you have time, get it in a second time. It's only going to be that much better for you. And that's it for this first exercise in this knee replacement exercise program number 2. It's straight leg raise with the quad set. Don't forget about that ice. Take it easy, elevate when you need to, and make sure you get out and do some walking.